Hey Michael, my name's Blayne Arnold. I'm a proud descendant of the Ngamba people, which is from sort of central west New South Wales, a little town called Warrana. I now live and work on the Gold Coast and a lecturer at Griffith University, where I guess one of my roles is looking after the cultural capability of our students, and I'm doing my PhD in looking at culturally appropriate approaches to prepare students to work with First Nations Australians.
Great. Yeah, really nice to talk with you today as well, yarn with you today as well, Blayne. My name's Michael Reynolds, Wiradjuri man. Wiradjuri, across Western New South Wales, and my mum was from Dubbo, Wellington way, but I grew up in Sydney, off country. I've been involved, I'm a sports and exercise physiotherapist, but I've been involved with the APA for probably 15 years almost now around reconciliation. Ex-chair of the Aboriginal Torres Strait Islander Health Committee, now chair-elect of the Australian Physiotherapy Council, but my day job is associate professor at Australian Catholic University, where I'm the Indigenous Curriculum and Pedagogy lead for the physiotherapy program, deputy head of school, allied health, and also fitting in a bit of research looking at enablers for Indigenous Australians university completion.
Yeah, nice. Looking forward to picking your brain, learning from you.
Oh, yeah, we can learn a lot from each other always. Yep. So it's good yarning with you today. Yep. Blayne, you're doing a lot of work now in your PhD. How far are you into your PhD now?
So through confirmation, so
well
about 18 months in. Things are going well.
18 months in, well supported, and you've got a study, is that right?
Yeah. So
do you want to tell me about it?
Yeah, done the first study, which was looking at how prepared physiotherapy students feel to work with First Nations Australians. So one of the things that we thought was important is actually getting the students' voice in terms of how they're feeling right now. So we did a range of surveys with our undergraduate students, so a 4-year bachelor's program, and we're really interested to see across the 4 years if there were any differences in how they were feeling. So we had a huge turnout, so I think we had over 300 of our students that completed the surveys, which was great.
Great to have engaged students.
Yeah,
that's particularly for research. That's good.
That's right. So we have a look across those, and then from that they could elect to have a yarn with me, so we could, I guess, do a semi-structured interview to, I guess, understand a little bit more about what they were feeling. And from the survey results is that all students reported that they felt underprepared to work with First Nations Australians, and the second year students was the most, is that they had the lowest scores. And I think that's probably they're trying to figure out how to be a physio. Yeah, things are starting to get real for them in the actual learning the physio craft, and they're starting to go, well, I'm not even sure how to be a physio, let alone how to work with a First Nations person.
So you had semi-structured interviews with second and fourth year students, was it?
First, second, third,
fourth. And did you see many changes across the span of their learning? Like, did they find that things were a bit harder than they thought in fourth year? Did they think they knew it all in first year?
So our first and second year students, they were similar in what they were thinking, and our third and fourth year students, they were similar. And I guess our first and second year students weren't sure how working with someone from a different cultural background would be any different. And I guess our hypothesis behind that is that in those early years they're learning fundamental skills like range of motion, so they probably can't see how that might be different. But when they get to third and fourth year, they were going, I do feel underprepared, and acknowledging that there's so many different cultures within Aboriginal and Torres Strait Islander culture across Australia, and they say, well, I might learn about one cultural group, but how does that apply if I was to go 2 hours down the road or move states, and whether that would be something they would have the skills to be able to apply it in a different place.
Yeah, it's interesting because when we look at a lot of physio programs around the country, they're built on these core elements of, yes, we need to look at range of motion, looking at consent, and all these things, these foundational sciences that underpin what we do in anatomy. And one of our core skills as physiotherapists is being culturally responsive. Not just for Aboriginal and Torres Strait Islander people, but for all people. Where do you see your research affecting that, particularly in those formative years in first and second year? How do you see your research affecting teaching for first and second year physio students as laying down cultural responsiveness as one of these core skills that physios need?
And that was something that certainly came through, is that the first and second year students were just wanting more content, wanting it more in the classroom. So then we reflected on that and went, well, it's really the teachers, the academic staff that are responsible for what's delivered in the classroom. So we're then putting together the next phase of our study, which is to then be able to upskill non-Indigenous academics to be able to integrate more of that First Nations knowledge into their curriculum, particularly into those first, second and even third year subjects when they are in the classroom.
When I've looked at, I suppose, part of my role with APC and some connection with CPDANS, that's the Council of Physiotherapy Deans in Australia and New Zealand. When we survey educators, people are scared to act, and they're also scared of doing the wrong thing. And I think there's almost this paralysis that of action, or not knowing how to engage it in training and in their learning, in teaching and learning. So what would you say to program leads, course coordinators, or people that are working to embed this in their units? This is to educators. How should they go about becoming more culturally capable, or maybe feeling more confident in embedding some of this content into their units? Yeah,
that's something that we found as well, is that trepidation of not wanting to do or say the wrong thing. But in terms of looking at how you would start to embed things, and I think it's looking at your curriculum as a whole and being able to have the entire physio team on board, and not just being one person's responsibility, but saying, okay, as a staff, as a collective, we think this is important. I know the APA thinks this is important. I personally think this is important. You think this is important. Is as a collective, we need to look for strategic opportunities within our curriculum that might align with particular First Nations ways of knowing, doing or being. And I think that in the early stages, something that's quite achievable for most programs would be look at communication, and certainly maybe taking it away from the traditional patient therapist dynamic and putting it into more of that social yarn scenario where you get to know the person, which is still a fundamental skill of physiotherapy, but it's slightly changing the lens.
Yeah. And universities can sometimes see, and some would argue in some sectors, some areas have sort of lost their social license to operate. They sort of operate, seen as businesses sometimes, and maybe a little bit on the nose to community. So how important is community in helping to shape curriculum and helping to build capability in staff, so both Indigenous and non-Indigenous?
Yeah, I guess the whole idea that people want to be a physio in the first place is to help people. So with any of our curriculum design, we need to be looking at what community we're going to serve and to provide that help. And the only way that you can do that is by asking and engaging with community, and whether it's Indigenous or non-Indigenous, but building those relationships to have that open and frank conversation around what are the needs of this community that we're going into, and I mean by going into work and practice, to be able to give back, because I guess that's the whole idea of healthcare, is that we're there to serve and to care for a community.
And did you have an opportunity to share some of this research or some of the findings of this research with communities where students are going out into?
Yeah, so that's been something that's been really important to me in terms of doing that due diligence and making sure that I'm talking to, yarning to everyone across the way to make sure that what we're doing and the ideas that we're having do represent, I guess, a collective, and they're not my ideas, and understanding that that's a really important First Nations approach to I guess learning and building information together, is that it's done on a collective basis, not an individual basis.
It's so important that co-design and reciprocity, which I think is lost in some research, but once it's there, the impact of that research is astounding. And I don't think it's something that should just be in Indigenous research. No. This is something that should be everywhere, and there's this big wave of more participatory action research across disability sectors and well, it's not limited to that, but it's everywhere, where patients and consumers are very much a part of the research and part of the design and part of the implementation, which really improves impacts. And that approach is just not negotiable, isn't it, in Indigenous research?
Yep, and I think that being able to, whether it's looking at it through an Indigenous lens, is the fact to be able to have that co-design, like you mentioned, is that really the idea is trying to put that person at the centre of the discussion, isn't it? That we're there to help that person, not to help someone with a knee injury. Is that they're more than a diagnosis, they're a living, breathing person that has a complex life like we all do, and trying to take those things into consideration.
Yeah, and when we look at, there's so much stuff that's happening in the AP. I'm really proud of the APC, the Australian Physio Council, and others, and universities around the country that have really embraced embedding health curriculum framework and a whole other range of measures to improve teaching and learning environments and really update the curriculum to meet more contemporary needs and the needs of Indigenous Australia. We don't really know the impact of that yet. I suspect we will in maybe 5-10 years. What our graduates are we really truly delivering culturally safe care? Talking to some communities around, I know Griffith have a really strong connection to several communities in health. How do you feel that's going? Like, how are they perceiving the university and Griffith graduates?
Yeah, I think that's probably, to sidestep that question a little bit, is probably that it is too early to tell at the moment. And something that I'm conscious of is not overburdening those communities and going in and asking them to evaluate our students at every single turn, and to say, actually, we do need to just give things time. In the fact that if there's a problem or an issue, please let us know. But other things, there almost needs to be that sense of organic growth where we learn, we build on it. And I think in 5-10 years' time, I'm hoping that we've got a more culturally capable or culturally safe profession. And
that just happens with this ongoing engagement. We talk about cultural safety, or going towards cultural safety being this long life journey.
That's right.
A lifelong journey, and it's very much that at an organisational level as well as a personal level, isn't it?
Yep. Yeah. How have you gone about, I guess you mentioned that you're the pedagogical lead in your role. How do you go about implementing that?
It's interesting, I started that role at ACU in 2021. I'd done some guest lectures and some lectures at some other universities before, and I took it on because I saw a real opportunity to create change, and I saw what was happening within the Physio Association. I saw what was starting to happen through APRA as well, and through the accreditation frameworks. So I was quite excited to join. When I joined, I had a very broad position description. I was the first person to hold that role. I had nothing to go off. They were looking to me for advice, someone who'd never been in the university sector at all. I was a clinician. I was working with sports teams. I was working in general private practice as a sports and exercise physio. So it was a big change for me in terms of my mindset and how I had to approach the work. Who I connected with was different. How I connected was different, because it's a lonely place. University, I was the only, and still are the only, Aboriginal and Torres Strait Islander curriculum and pedagogy coordinator is my title in physiotherapy. I'm not working with anyone else to do that. Now, fortunately, I work within a School of Allied Health at ACU, and I have counterparts in some of the other disciplines, but we actually rely very strongly on each other. And I lean very much on networks that I've grown through the APA as well, and it'll be yourself as well as Curtly Nelson up at UQ I've spoken to a lot. Sarah Large down in Melbourne's doing fantastic work. There's Sarah Velli-Gold at University of Sydney. There's a growing amount of Aboriginal and Torres Strait Islander academics now, and for me that's a really important part of it. Gives me strength to know that I'm doing kind of the right thing from that perspective. But then it's also continuing to talk to peak industry groups, so looking at IHA. We've got a memorandum of understanding with Indigenous Allied Health Australia. So we have some external oversight of what we're doing, and if we're not doing the right thing, they'll let us know. And so that's been really helped with our strategic development in rolling out, let's say, cultural responsiveness training, for example. Who do we do that with? How do we, engage with different stakeholders within the university to drive that change? How much needs to be student facing? How much connection with Indigenous higher education units? It's quite the supports, the wraparound supports we need to provide for students and even for non-Indigenous staff to embed this stuff are extensive. This is why I'd really encourage universities, if they don't have it, to have these coordinator roles, because there's a lot going on. But for me, working in that space, I don't think I could operate without people like you around Blayne and others in that broader network, because with that we learn and share and grow and figure it out. And I love that that's starting to happen. We're very slowly starting to get this critical mass of people in positions where they're needed, but it just still needs to get better. So it's a hard slog working in a Western academic institution, doing this kind of work, and not everyone agrees with it. There's a little bit of pushback here and there, but when you've got strong allies, you've got people that have your back when you're not there, that means a lot to me, and I really do have that quite strongly at ACU, which I'm really thankful for, and I'm sure you've got that at Griffith.
Great team around me, but I guess I'll thank you as well for paving the way for us to be able to have a space in academia to be able to come through and I guess continue what you've sort of started, and I guess, like you said, build that network in and around Australia for that growth in that area.
I mean, it's clearly not just me. There's a lot of people that care very strongly about this. But what's important is that we create an environment where I talk about particularly the younger Aboriginal physios coming through, the students coming through. I say, you don't understand how strong your cultural superpower is. They don't understand. It's something they have. It's not, I'm biased, but it's not just another cultural identity. And everyone should be super proud of their cultural identity because it makes them who they are, drives their behaviours, drives their values. And once you recognise that, you know how big a difference you can make. Anyone that can connect with their cultural values connects with who they are and how that manifests in their work are going to be great physios. Now, because we've got this really long surviving culture across all our cultures around Australia as Aboriginal and Torres Strait Islander people, we come with a really special set of cultural identity skills, I suppose, to do this and influence and change a shape of healthcare. I really do believe that. And I think the more people you get talking that language, the more students the more good things you see from a cultural perspective in students and each other, and certainly from Aboriginal and Torres Strait Islander people, that you see people with strong culture, you look to them and you admire them. You admire elders, you admire old people and stuff that are really connected with that, and you just could sit and listen to them all day.
And I even admire the students coming through, and the fact that it's so proud to look at it and say that First Nations students' numbers just is increasing almost every year in the profession. It
is.
That's so cool.
A little bit slow for my liking, but I'll get back to my point. If we create the environment for people to be the best versions of themselves, they will be the best versions of themselves. And it's about looking at what the secret ingredients are. What's the special sauce that makes anyone good? Is it different for Indigenous people, Indigenous kids coming through? Maybe it is, maybe it's not. But we need to ask. We need to start to explore those things. And we need to create environments where people can really thrive and prosper. I think that's probably the biggest challenge that universities have today. And it's not about getting kids ready for university, that's part of it. The bigger part is how ready are universities to take on these kids. And if we look at that pipeline, we see that access rates, so Aboriginal Torres Strait Islander access rates, so coming into university, that's increasing. It's about 2% at the moment. Our completion rates now are about 1.1% of the total physio population. 1.1% of graduates identify as Aboriginal Torres Strait Islander. When we look at retention and completion rates, it's across all courses, health, everything. They really haven't changed much for the last 10, 15 years. Now, there's some universities that are doing reasonably well and some aren't, and they still sit about 20 points below non-Indigenous. So there's something that happens where people come into university where we don't maintain, they don't have those supports. There's not adequate supports to keep them in the game. And if people don't go through to completion in courses, employment outcomes, health outcomes, whatever, they're not really much better than if you never started, and they're whacked with a big student debt.
Yep.
So we need to provide spaces. We need to understand what the needs of Aboriginal and Torres Strait Islander students have coming into university, particularly as students, but also as staff. Provide whatever supports they are for people to thrive.
Yep.
And sometimes it's not difficult. Sometimes it's just an attitude. It's a culture.
Mm-hmm.
Culture beats strategy all the time.
That's right.
And everyone's saying it, and it's true. It's
Yep.
very true. And if we can create a culture where people are included, and not just included to exist, not just to get a pass to come in, but to really see, well, we recognise the strengths that you have within yourself, and we want you to be the best person you can be. Then you start to supercharge people's education, you supercharge people's academic careers, their clinical careers, and you get really good contributors to the profession and healthcare.
Yep. And I guess one of the things that we know from talking to First Nations communities is that there's a strong preference to be treated by or seen by people from your own culture. And if they're not from your own culture, that at least understand your culture. So I guess that brings us back to, all of the non-Indigenous students and trying to make sure that they're prepared to go out and work.
Absolutely. Like it's still, the figure is still a bit over 20% of Aboriginal and Torres Strait Islander people experience racial discrimination when they see a healthcare practitioner in this country.
Yep.
1 in 5. And to be able to shift the dial on that, it's really important that Aboriginal and Torres Strait Islander people are there and have agency. Mm-hmm. So they have voice and agency. So their perspectives are being heard in curriculum, it's being heard in the policy design, it's being heard in service delivery.
Yep.
Because if it's not there, it's that the policy, those service delivery models are not going to have a great impact for the people they're supposed to serve,
Yep.
Aboriginal communities. This is why self-determination is so important. This is why working very closely or asking Aboriginal community-controlled health organisations, what do you need to be healthy and well? And sometimes it's not physio. Mm-hmm. And physios, I think, need to step outside their comfort zone a little bit and think, well, maybe I can't treat this. Maybe there's something else I need to be looking at here.
Yep.
And having that patient-centred, truly patient-centred, holistic view of healthcare, I think, is something that needs to be driven even further into particularly undergraduate curricula.
Yep.
Yeah, or entry-level curricula.
Yeah, and that will certainly challenge the status quo in terms of you've got 20 minutes to do your subjective, get all the information you need and formulate what your objective is, and maybe it's just you need to listen to this person, and that's maybe all you need to do. And then to think, okay, well, let's come back and we can listen again, and then it might not be, like you said, the physio is not the person that needs to be involved today.
That's right. Blayne, your research is looking at, do graduates have the attributes they need to treat Aboriginal and Torres Strait Islander people? Do you think it's got any? I see a lot of physios even that say, I don't know any Aboriginal people. I don't see any Aboriginal people. I don't treat them, so I don't really need to do this. Do you see that there's a benefit for those people? Do you think it's just something that's just too hard for them to, they shouldn't need to worry about it? They've got other business pressures. They've got to worry about how they're going to embed Gen AI into their practice. Yep. Cultural awareness is maybe, or cultural responsiveness is maybe a bit lower on the pecking order. Do you think there's any benefit for them to do that? Yeah,
I absolutely do. And I have this discussion with lots of people all of the time. And we know that if you're better equipped to work with Aboriginal and Torres Strait Islander people, then you're going to be better equipped to work with people from any diverse cultures from your own. And we know that in Australia it's a very multicultural country, so I would argue that no one's working in a silo where they're not seeing or interacting with someone from a different culture. And then I just look at it to go, well, first people's first, is that you can't, train everyone to work with every culture because there's not enough hours in the day. So if we concentrate on first people's first, equip people with those skills to work with someone who's from a different cultural background to them, then they're going to be better equipped to work with anyone moving forward.
I teach, and maybe you teach the same thing, the first step to going towards being a culturally safe practitioner, and this is in the APRA definition of what we need to do to be culturally safe as well, we need to reflect on our own worldviews and our own biases and our own identity in terms of what we would expect, and know that that's not necessarily what the patient on the other side of the table is going to expect. And I think adopting a sense of cultural humility is really important. We come with some brilliant skills coming out of universities, physiotherapy skills. We come with really good interpersonal skills, we hope, when we come out, but we don't have the whole answer, do we? We don't have the whole solution for anyone that we see. We need to be curious and ask them the right questions. And I'm hoping that new graduates are asking better questions of patients than maybe what was being asked 30, 40 years ago.
Absolutely. And I think you're right, is that first step is inwardly reflecting and recognising your own culture, because everyone comes from a very rich culture, and I guess if you can unpack that and understand a little bit more about where you come from, then it's easier to understand where someone else comes from as well.
Yeah, it's so interesting, and we do. 51% of the Australian population are either born overseas or have a parent born overseas. So people do come from lots of different cultural backgrounds, and I think it's really, I'm a little saddened by the fact that when we talk about cultural responsiveness with Aboriginal Torres Strait Islander health, people think they just go, well, this is the one thing for Aboriginal Torres Strait Islander people and it's one thing for everyone else. It's not really the way it is. There are specific things that we need to be looking at and understanding around the effects of colonisation, social determinants of health, issues with mental health, understanding that culture and what are the levers that we can look at that really can drive better health and wellbeing in that culture. But when we're talking about being culturally responsive and reflective, it really is for all people that are coming through our doors and being curious and asking those questions about what makes you fit and well.
I think we could yarn all day about this.
Oh, we could. Of course we could. Of course we could.